Do you have spasticity related to cerebral palsy? Are your muscles tight and stiff? In another Utah Neuro Rehabilitation YouTube video, I talk about spasticity. I talk about what it is. Today, I'll talk about treating spasticity in cerebral palsy. I'll give you an overview of the different treatment options. Spasticity can make walking more difficult. It can make it harder to use your hands. It can be painful, and it can make cares really difficult. If it's not managed, it can also lead to contractures, which are fixed joint shortening positions. But spasticity can be helpful. If a person is really weak, spasticity in the legs can help them stay upright, can help them walk. So when you treat spasticity, always have a goal. Maybe that's to improve walking, use your hands better, decrease pain, make cares easier, prevent contractures. There are several different ways to treat spasticity in cerebral palsy. Each person is different, so you really need to look at each person individually. In some people, one spasticity management tool might work. In others, several options might do better. First of all, there's therapy. Therapy can help with stretching, with bracing, or with strengthening weak muscles. Another spasticity management tool is oral medications. There are several medications that we use. Baclofen is the most common. Baclofen can take the edge off of spasticity, but it's not going to eliminate severe spasticity. Its most common side effect is drowsiness. There's also botulinum toxin injections, like Dysport or Botox. I talk about this in another Utah Neuro Rehabilitation YouTube video. But essentially, these are injections of Botox or Dysport into tight muscles, and it can loosen the muscle, decrease the spasticity, and they usually last for a few months. Phenol is a chemical that can also be injected into tight muscles. It's been around for a long time. It hurts a little more going in than the Botox or the Dysport, so often with children we use sedation. Often it lasts a little longer than Botox or Dysport. Sometimes, if a lot of muscles are tight, we can inject Dysport or Botox into some muscles and phenol into other muscles. Intrathecal baclofen pumps are another way to treat severe spasticity. Remember, we use baclofen as a spasticity medication. Usually it's taken orally. But this medicine can also be put in its liquid form in a pump. The pump looks kind of like a hockey puck, and it's implanted in the abdomen. Then it has a tube or catheter that goes around to the back and goes into the spinal fluid. Baclofen in the spinal fluid is super powerful, so it can really lower severe spasticity. Typically, it works better in the legs than in the arms. The pump is programmed with an external computer, so you can adjust the baclofen to get the best dosage for each person. There are complications with pumps. The catheters can kink or tear. You can have an overdose or an underdose with withdrawal, and these can be serious. So you need to think carefully before placing a pump and consider all of the pros and the cons. Typically, it's used for people with severe generalized spasticity, meaning spasticity all over. Selective dorsal rhizotomy is another option for spasticity management in cerebral palsy. It's a neurosurgical procedure. The neurosurgeon makes an incision in the low back. The surgeon then finds the sensory or the feeling nerves that goes to the legs. These nerves are teased apart and stimulated electrically. The ones that cause a lot of jumping or a lot of spasticity in the legs are cut. Often anywhere between 25% and 50% of those nerves are cut. So after the surgery, there can be some loss of feeling in the legs. Most of this comes back over time. This is a way to permanently reduce the spasticity in the legs. But you need to be really careful and thoughtful about this also, because if a person is weak and uses their spasticity to walk, then you may not want to get rid of all the spasticity. Orthopedic surgeries can also treat the deformities that are caused by spasticity. Orthopedic surgeries can involve operating on soft tissue like tendons or on bones. This may involve lengthening a tendon that's shortened. For instance, sometimes the Achilles tendon is shortened when there's a lot of spasticity in the gastroc muscle. Bony procedures might involve straightening bones or putting in staples to better align bones. So there are several options for spasticity management in people with cerebral palsy. Each person is different, so these options really need to be individualized and well thought out. It's often best to work with a team of doctors, therapists that understand you to help you make the best decision. Also be sure to understand the pros and the cons, the benefits and the risks of each procedure.